Welcome to the second lesson of Module 5 on Incident Response, in which we focus on incident reporting. In this lesson, you will learn about some of the general steps to take when responding to a cyber attack and hear more about what incident response plans can describe in terms of your roles and responsibilities of responding to a cyber attack. Let us first go through some general guidelines for reporting procedures in case of a cyber attack. After you have recognized signs of possible cyber attacks such as unusual system behavior, unauthorized access, or the presence of ransomware messages on computers, one of the first things you can do is to disconnect affected devices or systems from the network to prevent further spread of the attack. This could, for example, include unplugging network cables or turning off Wi-Fi on compromised devices. The next step might be to notify your IT department or designated security personnel immediately, so that they can take the lead in assessing and responding to the cyber attack. Your organization will likely have an incident response plan that provides guidelines for healthcare staff to respond to and mitigate the impact of cyber attacks. It is very important that you are familiar with this plan and the roles and responsibilities it sets out for you. Let us now look at what such a response plan might include to give you a better understanding of the subject matter. Firstly, your organization incident response plan might include an overview of relevant regulations, including the GDPR and local data protection laws and your organization's commitment to compliance. The incident response plan can also include definitions of essential cybersecurity terms and concepts that we explored in previous modules of this training program, such as malware, ransomware, and data breach. It is very important that everyone knows exactly what roles and responsibilities she or he has when responding to a cyber attack. In the following, we'll look at two distinct roles described in an incident response plan. Let us start with the roles of a patient care coordinator. Roles of a patient care coordinator would be to ensure that patient care remains a top priority during a cyber attack, and to coordinate with department heads and care teams, and relocating resources if needed. This could include relocating medical supplies, equipment, and personnel to areas where they are most needed, particularly in the event of a system downtime or resource shortages. It could also include providing guidance and support to colleagues, ensuring that they are following established protocols and procedures during the emergency. Your organization's incident response plan might also assign somebody to the role of emergency response coordinator. If you're assigned that role, you could be responsible for coordinating the overall response to ensure patient safety. You would work collaboratively with other key personnel, including IT experts, administrative staff, and security professionals, to ensure a well-coordinated and effective response to the cyber attack. Additionally, you should remain calm under pressure and prioritize patient care and safety throughout the incident. Your role as emergency response coordinator could include ensuring that essential patient care activities continue without interruption, and that effective communication channels remain open to relay critical information to healthcare staff, patient, and relevant stakeholders such as families. You might also be asked to monitor access to patient data during the incident in order to ensure that only authorized personnel access sensitive patient information. If electronic health records or administrative systems are compromised by a cyber attack, you would aim to maintain manual records, such as patient charts, to ensure that patient data remains accessible and accurate. Because you work closely with patients, you might also be assigned to verify patient identities and medication administration to prevent data manipulation or further unauthorized access. Similarly, you might coordinate the process of notifying affected patients and assisting with their questions or concerns. The role of emergency response coordinator might also include overseeing the implementation of emergency procedures, including those related to patient care, patient transport, and life support systems. If the situation requires, you might be responsible for coordinating the transfer of evacuation of patients to other healthcare facilities and ensuring that patient records and medical histories are securely transferred. In addition to the possible roles and responsibilities outlined, your organization's incident response plan might also describe your roles in the recovery and mitigation of data loss following a cyber attack. This might involve working closely with IT experts, data recovery teams, and cybersecurity professionals to ensure a coordinated effort in data recovery and mitigation. You could assist in the reconstruction of electronic health records and other patient data if backups are available but need to be restored. This can be done by testing the restoration of data from backups and then verifying patient identities and medical histories to ensure that data accuracy. You might also be asked to communicate with patients and their families to explain any data loss or inaccuracies and reassure them about the steps being taken to mitigate the situation. The organization's incident response plan might also include detailed procedures for recording incident details. Let us look more closely at what incident documentation can include. It basically involves a systematic recording of information and actions taken during the incident. This documentation is essential for various purposes, including post-incident analysis, legal and regulatory compliance, and internal reporting. As a first step, incident documentation means recording the exact date and time when the cyber attack or suspicious activity was initially detected. A second step can involve describing the type of incident, for example, malware infection, ransomware attack, data breach, and so on, and any relevant details about how it was discovered. Further, incident documentation would include listing all systems, devices, and networks that were impacted by the cyber attack, including information about whether these systems are critical to patient care. Incident documentation would also assign a severity level to the incident based on the predefined criteria in order to help prioritize the response efforts. Finally, incident documentation would serve to categorize the incident as a security breach, data breach, malware infection, or other relevant classifications based on its characteristics. To help with the incident debriefing and post-incident analysis, it is also important to document the immediate actions taken in response to the incident. This may include isolating affected devices, shutting down systems, and alerting key personnel. In a similar vein, the incident documentation would list the resources used during the response, including personnel, equipment, and software tools. Very importantly, a chain of custody would be described, meaning what if evidence is collected. The organization can maintain a chain of custody record to track if the handling of evidence to ensure its integrity for potential legal purposes. This can include copies of all internal and external communications related to the incident, such as emails, messages, and notifications. If patient data was involved in a cyber attack, the incident documentation would also document access logs in order to track who accessed the data, when, and for what purpose. It would therefore capture digital evidence related to the incident, such as screenshots, log files, or system snapshots, and store them securely. Your role in incident documentation should be clearly described in your organization's incident response plan. In conclusion, it is important to familiarize yourself with your organization's incident response plan and how to be aware of the potential roles and responsibilities you might be assigned in responding to a cyber attack. Thank you for your attention.